Welcome to this year's benefit presentation for Southern Bancshares. We are glad you have joined us today, and we hope this meeting provides you the necessary information for this year's open enrollment.
This presentation has been put together by Insurance and Financial Services of Texas. Again, this is Al and Jordan Cozart. Please feel free to reach out to us at any time during this year for benefit purposes. We are happy to help you.
Open enrollment will be held early this year. Enrollment meetings will be held at the majority of bank locations during February 5th through the 8th. There have been a few changes this year, so we need to make sure everyone reviews the benefits thoroughly. In order to help reduce the employees' cost, management has decided to adjust both the buy-up and base plans slightly this year. Also, Southern Bancshares will be increasing the employer HSA contribution to $125 per month. Due to high utilization, dental rates did increase a little bit this year. Everything else is pretty much the same.
The last date to enroll in benefits is going to be February 8th. We will be having face-to-face enrollment meetings with Colonial as usual. There should be sign-up sheets going around at each location. Please schedule a time to meet with an enroller. If you're unable to attend one of these enrollment meetings, please email or call us as soon as you're aware, so we can provide you with an alternative enrollment.
Please see the following schedule for the date and time IFS will be visiting your location. During these enrollment meetings, licensed insurance agents will be present to enroll you in your benefits. It will be beneficial to come to these enrollment meetings with a good idea of what you want to enroll in. Make sure you have conversations with your wife, husband, or family before meeting with these enrollers. They are here to assist you with any questions you may have about the different products offered.
Please contact Human Resources if you experience one of the following family status change events: marriage or divorce, birth or adoption of a dependent, change in employment status, dependent satisfying or ceasing to satisfy the plan's eligibility requirements, loss of significant change to your current coverage, judgment, decree, or court order, enrollment in or ceasing to be enrolled in Medicaid, Medicare, Child's Health Insurance Program. You will have 31 days to submit the Universal Enrollment Form to HR in order to be eligible for making any changes to your benefits.
Who is eligible for coverage and benefits? Full-time employees working at least 30 hours per week and been employed for 30 or more days as a full-time permanent employee. You're able to cover your legal spouse, children up to age 26, and disabled children of any age.
United Healthcare will continue to provide our medical insurance. As you are well aware, they have an expansive network with many doctors, hospitals, and pharmacies to choose from. The buy-up plan will continue to offer zero primary care physician copays for kids up to age 19. Save time and money with virtual visits. Employees can see and speak with a doctor 24 hours a day, 7 days a week using a mobile device or computer from the convenience of your home or office. These doctors are able to treat and prescribe medications remotely. The cost is around $45 for HSA members and a $30 copay for buy-up members.
Here are the new plan designs for this year. First, we'll look at the base plan. The base plan's deductible went from $4,000 for an individual and $8,000 for a family to $5,000 and $10,000 respectively. The coinsurance remains at 80%. Preventative care is still covered at 100%. Out-of-pocket maximum went from $6,500 and $13,000 to $6,350 and $12,700. So actually, the out-of-pocket maximum on the base HSA plan went down, which is great. If we look at the buy-up plan, you will notice that the primary care office visit went from $25 last year to $30 this year, so slightly higher. And the non-preferred specialist went from $50 last year to $60 this year. The deductible went from $1,000 last year to $2,000 this year for individuals, and for family went from $2,000 last year to $4,000 this year. It will continue to be a 100% plan, So after you've reached your deductible, only copays for office visits and prescription drugs will apply to your out-of-pocket maximum, along with any urgent care and emergency room copays. The out-of-pocket maximum went from $2,500 to $3,500 for individuals and $5,000 to $7,000 for families. Again, urgent care, emergency room, and prescription drugs are all the same as last year. Here you can see the payroll deductions for 2019. As you can see, the rates have gone down substantially due to low utilization and low claims for last year, as well as changing the plan designs up a little bit to help save some more costs and keep more money in your pocket. Health savings accounts. If you haven't had a chance to review our recent health savings account video, we highly recommend that you go and check that out. It's going to provide a lot more information and detail about the benefits of saving in a health savings account. All right, now we'll look at the requirements in order to be in a health savings account. First, you must be covered by a high deductible health plan. You also cannot be covered under any other plan that is not a high deductible health plan. You cannot be covered by Medicare, and you cannot be eligible to be claimed on another person's tax return. Southern Bancshares is increasing their HSA contribution to $62.50 per pay period. You can also contribute to your health savings account up to the IRS limits. You see below the chart shows that 2018 coverage for an individual went from $3,450 to $3,500, and for a family went from $6,900 to $7,000. If you're 55 or older, you can also add an additional $1,000 to that limit. Please remember to include the $1,500 of employer contribution when determining your HSA limits. Anyone new to the HSA plans for this year will need to fill out a UMB paper application, and anyone changing their HSA contributions must fill out an employee contribution change form. These will be provided to you at your bank locations during open enrollment. Also, the enrollers should have your current contribution amounts. So if you want to change these, you can figure out what you want to contribute going forward for this year.
The dental plan will continue to offer the same benefits as last year. Annual maximum is $1,500 per person per calendar year. Preventive services are covered at 100%. Basic services such as fillings and simple extractions are covered at 80% after reaching a $50 deductible. Major services include bridges, crowns, inlays, onlays, complex extractions, and are covered at 50% after a $50 deductible.
Here you can see the payroll deductions for the dental plan. As you can see, the employee rate is continuing to be zero. Southern Bancshares is covering 100% of the employee-only cost. The other tiers have gone up slightly due to high utilization. I think it's a few dollar difference for each of those, but overall I think it's still a very competitive and affordable dental option.
The vision plan is also the same as last year's. Eye exams with dilation is a $10 copay. All lenses are covered at 100% after a $25 copay, which you can take advantage of every calendar year. You also receive a $130 allowance for frames every other calendar year. Medically necessary contact lenses are covered at 100% after a $25 copay, which is available for every calendar year.
Here you can find the payroll deductions for the vision plan through United Healthcare. The rates stayed exactly the same as last year, and they are very competitive compared to the market. Southern Bancshares offers employer-paid basic life and AD&D through Sun Life. As you can see, there's classes associated with benefit amounts. For Class 1, anybody that falls under executive would receive a $200,000 benefit. Class 2 is a salary range of $30,000 and up would receive a $40,000 benefit. Class 3s is anybody ranging in salary from $16,000 to $29,999 with a benefit amount of $25,000. And Class 4 is anyone with a salary ranging under $16,000. Sun Life will continue to offer voluntary life and AD&D at the same rate as last year. The maximum benefit amounts remain the same of $500,000 for employees, $250,000 for spouses, and $10,000 for children. The guaranteed issue amount only applies to employees who did not have the opportunity to enroll in the voluntary life products last year. Everyone else can keep the same amounts as last year with no evidence of insurability, but anyone who's looking to increase their amounts will have to fill out a short health questionnaire, and this form can be provided by your counselor at enrollment.
Sun Life will continue to offer short-term and long-term disability at the same rates as last year. Disability insurance protects you from loss of work and ultimately loss of wages due to an accident or sickness. Disability insurance is important to ensure that you have the means to make ends meet, to put food on the table, and to pay your bills. We recommend you analyze your financial situation to determine if this product is right for you. If you do not have a decent sized emergency fund, we highly recommend you consider the short-term disability. As far as the long-term disability, we believe that it is a great product no matter your financial situation.
Another plan being offered this year is the Colonial Life Cancer Plan. There are numerous unexpected costs that arise when diagnosed with cancer that your medical insurance does not cover. For example, loss of income, child care, lodging and meals that may be needed, deductibles and copays. As you see on this chart, the initial diagnosis payment is from $1,000 to $5,000. Your hospital confinement is $150 per day on the first 30 days, and then after 30 days, it's paid at $300. All of these benefits listed are paid directly to you. As you see in the rates below, they're very reasonable. And this plan offers you great protection against cancer. Here's a second plan that's offered through Colonial Life. It's the critical illness plan. These plans basically complement your major medical by paying you a lump sum benefit if you're diagnosed with the following conditions: coma, blindness, permanent paralysis, heart attack, stroke, major organ transplant, kidney failure, HIV, hepatitis B, C, or D, and even coronary artery bypass. On this illustration, you can see we are guaranteed issuing an amount of $20,000 per employee and $10,000 for your spouse. But please note the rates for the employee and spouse are based solely on the age of the employee. In order to cover your spouse, you, the employee, must select the critical illness plan. And lastly, these rates are fixed for the life of the policy and will not go up in the future. But again, this benefit is paid directly to you, not your provider.
Please see the checklist of things to consider before open enrollment. Discuss the benefit options with your family. Make sure to sign up for a face-to-face enrollment meeting. There should be a sign-up sheet going around at every branch. Information to bring to the enrollment meetings. Any changes to your personal information, including address changes, last name changes, etc. Any new dependent information, names, date of birth, and socials. Any beneficiary information, date of birth, names, and socials. Here are a list of items that you must submit during open enrollment. Anyone new to the HSA base plan will need to fill out a UMB application. Anyone wanting to update their HSA contribution amount will need to fill out the HSA change in contribution form. And anyone who elects over the guaranteed issue amount for voluntary life insurance will need to fill out an evidence of insurability form. All of these above forms will be available at the open enrollment meetings. Please make sure to fill them out and submit them before leaving the open enrollment meeting. Lastly, everyone will receive a physical copy of the personal information and elections that were selected. You must review this information in its entirety and sign the bottom confirming that everyone shown is accurate. Thank you so much for spending the time watching this video. Again, we are very excited to meet you all next week. Here is our contact information. If you have any questions, please do not hesitate to reach out to us, and have a great day.